Nowadays, we live in an era when taking supplements became the norm. So people are taking so many supplements that the industry of vitamins and nutritional supplements is growing by the day. One of those supplements is fish oil. So the use of fish oil has been controversial in terms of prevention and treatment of cardiovascular disease. There are some studies endorsing its use, specifically EPA, eicosapentaenoic acid, and docosahexaenoic acid, to prevent and also treat cardiovascular disease. However, there is no consensus. So there is an interesting study that was published in the British Medical Journal Medicine this month of May of 2024 by Dr. Chen and his associates. The title of the paper is Regular Use of Fish Supplements and Course of Cardiovascular Diseases, Prospective Cohort Study. This study is very interesting because of the results, and we will go into those results in a minute. So the problem that they are tackling is precisely that, the uncertainty in regards to the effectiveness of fish oil to prevent and treat cardiovascular disease. So they hypothesize that the use of fish oils is directly affecting the outcome when you use it as a primary prevention or secondary prevention in cardiovascular disease. So in order to answer their question and to test their hypothesis, they designed a very, very interesting study based on a statistical methodology that is not found frequently in the literature, and is called the multi-state regression. The multi-state regression is like a Cox regression type of analysis in which you determine a trajectory of an outcome in which you start from a healthy status and you can progress to atrial fibrillation, and from there you can progress to adverse cardiovascular disease, and then you can progress to death. So they analyze in that progression how the fish oil is affecting the risk of developing diseases at each one of those stages. The first thing to consider here is that this trajectory is arbitrary. Not necessarily you go to cardiovascular disease having to have atrial fibrillation first. You can go from atrial fibrillation to death without any other cardiovascular disease, or you can develop cardiovascular disease without atrial fibrillation. You can even go from healthy to die without having either cardiovascular disease or atrial fibrillation. But the authors, in order to facilitate the analysis, they made the assumption that these stages exist. Based on those stages, their statistical analysis found that the hazard ratio for atrial fibrillation in healthy patients was 1.32. That means that there is an excess of 32% in the risk of atrial fibrillation in healthy individuals taking fish oils. When you analyze the effect of fish oils on the appearance of cardiovascular disease when you were healthy, there is really no difference between ingesting fish oil or not doing it. However, when you divide the cardiovascular disease into groups, there is an increase, very slight increase in the hazard ratio for stroke, 1.15. However, the lower limit of the confidence interval, 95%, is 1. So we can say that the effect is not strong. On the other hand, once you have atrial fibrillation, the risk of, or the hazard ratio better, to develop adverse cardiovascular events is lower. That means that fish oil seems to be protective in those patients with a hazard ratio of 0.92. There is also a decrease in the risk when you have heart failure already to die. So that has been quantified as well in terms of hazard ratio in this study, and it's also an interesting finding. So what can we say with this? The conclusions for these authors is that the fish oil is not useful for primary prevention of cardiovascular disease. On the contrary, there is an increased risk of atrial fibrillation and stroke if you take fish oil being healthy. When it comes to secondary prevention, that means if you already have a cardiovascular event like a myocardial infarction, for instance, then there is a clear reduction in risk for adverse cardiac events. And this is actually compatible with findings of other observational studies and randomized controlled trials that have found a protective effect of fish oil. Let's go back to the primary prevention, which is probably the most important aspect of this paper. So it's shocking to think that fish oil, which seems to be so innocuous and benign, can actually be related to an outcome that is serious, like atrial fibrillation. Well, this is surprising, but at the same time, we need to take this with a grain of salt. Why? Because even though they use sophisticated statistical techniques to try to control for confounders, we have to understand that the UK Biobank this database consists of a lot of questions that were taken up from questionnaires, and there is no specific information regarding several aspects like the dose of the fish oils or even some confounders that are not registered in the questionnaires. So the outcome may be due to other variables that are hidden and are not being analyzed in this study. But regardless of this, we have to be very careful with the use of fish oils, because according to this study, they don't really add a significant benefit that can be risky. So in my opinion, it's probably not necessary if you are completely healthy to use fish oils. You should focus on lifestyle interventions in general, because the fish oil is not adding anything clear in this situation. However, for secondary prevention, fish oils, according to this study and many others, provide a clear benefit in prevention of adverse cardiac events. So it's important, if you are taking them, to continue doing it, and always get the opinion of your cardiologist in order to start this type of supplements. So again, this is a study that sheds light on an aspect that is controversial. In terms of primary prevention, fish oil doesn't seem to work much. Actually, it can be risky in terms of atrial fibrillation and maybe stroke. And for secondary prevention, it seems to be working. So that's in a nutshell what this paper is adding to the information that we already had. And I hope this can be useful and you can incorporate this information into your lifestyle. See you in the next episode.